Welcome to another in the series, the Sip and Chat. Welcome to another in the series, Sip and Chat. I am your host, LeLeith Tomlinson, and wow, the days are going fast, so are the weeks, so are the months, and so will be this year, 2024. We are right here in June again. I want to welcome you another time to this very engaging series that will be commencing in terms of our emotional response to situations. And this afternoon, I want to talk to us about the whole matter of anxiety. Now, it is the exam season. Most of the exams are wrapping up now, the CAPES, the CXCs, and there are other exams like ACCA that are going on as we speak. Now, one of the things that I think is very important is that usually during this period, a lot of persons are confronted with this emotional feeling that we refer to as anxiety. And I want to spend a little time this afternoon rather, talking to us about what is anxiety, different types of anxiety, and how do we manage these different types of anxiety. It was the word of the Lord. It's always a good source that tells us that we should be anxious for nothing, absolutely nothing. But through prayer and supplications, we should make our petitions be made known. However, all of us know, right, that no matter how we are cautioned to be anxious for nothing, based on what is happening around us, we're going to be trying to think to ourselves, am I going to be successful? What is the doctor going to say? Is he going to marry me? Is she going to say yes to my proposal? So there's always a number of situations that triggers this emotion. So what exactly is anxiety? So anxiety is a feeling of fear, dread, uneasiness, and it may cause you to sweat. But again, before we get deeper into how it manifests, it is also an uneasiness or a nervousness, usually over an impended or anticipated ill. Now, I want to stop right there. Anticipated ill. So a lot of times what we are anxious for is not things that we really know, but things that we are wondering in our minds. How will they go? So you can see how we're at this place, we're wondering about something and we don't even know the results. I think it was a few days ago, I had a mentee who was worrying about her scores during the bar examination. And only to find out after all that emotion and anxiousness and all that, she actually got 2 A's. But I think it is so, as I said earlier on, so human for us to say, wonder, did I do well? Because I need the scholarship and so on, that we are anxious. But I want to say to us, as I want to read 2 very important quotes for us. And one says, our anxiety does not empty tomorrow of its sorrows, but what it does, it's empty today of its strength. So sometimes when these feelings of nervousness comes over us, these feelings of unease, we really, as we become more mature and enlightened, because we're always going to have these situations, anticipated situations that we're nervous about, we need to say to ourselves, at the moment when we can feel this gush of nerves coming onto us, if I worry today, what will it change? If I worry about something today, what will it change? Trust yourself. You have survived a lot and you survive whatever is coming. So, depending on the nature of the situation, sometimes you have to brace yourselves for the end results. But really, when we look at some of the effects of anxiety and what it can do to you, or it can debilitate any individual, regardless of your status in life, when we are cognizant about the negative effects of anxiety, then we have to develop better coping skills when we are faced with situations or concerned about situations, how to respond to them. So let us go a little further. How does anxiety manifest itself? So first of all, we see anxiety in feelings of trouble concentrating, We see increased palpitations. We see making decisions. And sometimes in the midst of the anxiety, we make very irrational decisions because we're thinking, okay, this is going to happen, so I need to do this. And then when the situation doesn't manifest itself in the way we thought it would, then we say, oh my, I should have probably waited. I should have gotten some advice on this matter. And all that. So there's also the feeling of irritability. Even sometimes we can literally feel our skin itching us, our skin burning us. So different people, the symptoms can be heightened. All right. There's also tense or restlessness, nausea. We have abdominal issues, right? Distress. Sometimes people have acute bowel syndromes because of these different things, right? And we talked about the palpitations, sweating and trembling and shaking. A lot of people even get anxious. We're going to talk about situations where people get anxious. So one of them is like the dentist. Sometimes it's about a man might get anxious before his wife actually goes into labor or en route to go into to the hospital. And so those things happen. And you have a sense of impending danger, panic, or doom. So those are some of the symptoms of anxiety. Now, I want us to understand, because a lot of times we misdiagnose people. So, for example, for a short period of time or for a one-off situation, a person might get a little uncomfortable, a little distressed, a little nervous, and so on. I'm feeling very uneasy about a particular situation. However, there is a distinction about between just like a bout of getting an anxious feeling or feeling a feeling of anxiety, compared to when somebody actually is suffering from what we refer to as an anxiety disorder. No, it has gone. Just in anything, we talk about different magnitudes. No, it has escalated. An anxiety disorder can become so paralyzing that people can't even function. So what you want to do is that you want to learn to deal with mild anxiety before it becomes so overwhelming, so that you're actually not dealing with anxiety disorder, which is also on the scale, and according to the DSM, is also a form of mental disorder. So when the good book wrote about be anxious for nothing, it wasn't saying that everything is going to be okay, but it also channeled you as to, through prayer and supplication, getting help from persons, and just talking about your situations as well. One of the things I've found out is that a lot of times the things that we're anxious for or anxious about, many persons have gone down that road before, and the same place that you were at was the same place they were at, and they can tell you about their experience. However, we live in a society where we like to think that everything is private and everything is about me. So we don't share a lot of stuff. So it's not until probably years after or months after that somebody speaks about something that we say, whoa, you were going through that? And you recognize that the person was right beside you and that they too had a similar situation. So one of the things that we want to do when it comes to feelings of anxiety or any type of what we refer to as abnormal feeling, when your emotions don't fit into the norm, we want to find help. You don't necessarily have to go to a professional immediately, but one of the things that you want to do is that you want to share about your situation. I want to also emphasize that a lot of times when we reach to a certain chronic stage of our illness, we don't seek professional help. Now, there's a reason, right, where we do training so that we're able to provide professional care. Because I've seen so many times when persons are going through different things, the kind of advice that they get from different people. It was just this week, for example, somebody got stung by a bee, right? And a lot of older persons, their first response was that, you know what? You need to get 3 pieces of different bush and you need to put on the spot. Well, I'm not really sure what is the remedy behind the 3 different bushes, but that was the remedy. But the person had a severe allergic reaction to the bee, to the stung of the bee. So they actually had to get some form of medication. In the same breath, I'm saying that there is professional help out there. There are mental health professionals who are out there to help you. They have been trained. So when you're going through those moments of intense pressure, of intense unease, please get the necessary help that you need. We live in a country where we love to have what I refer as wow moments. Wow moments in terms of, wow, he was going through this, and we need to talk about this. But as soon as that 9-day wonder is over, enough attention is not given to a particular issue. So anxiety is a real issue, and it can develop further into what we refer to as a mental health disorder, or someone can have a real chronic disorder. We're going to talk about types of phobia and so on. Now, where does some of these phobia originate, right? A lot of them, sometimes they originate from our childhood, where we were fearful or anxious for something. It could have been a child who was abused, right? So everything that looks like a situation that would replicate the previous one in which they were abused, they become very anxious. They don't want to be in a room alone. It could be the color of the paint. It could be a shirt that the person wore. Stuff like those are what we refer to as triggers. So if that person is not disclosing certain things about themselves, then in certain situations you cannot mitigate against the anxiety, because you would have not been aware of what is that trigger. All right. So you can notice that somebody was fine and they get in a particular space and they begin to get sweaty, nervous, and you're trying to say, what happened? What happened? And you say, remove that color of that towel, and you're trying to figure the towel, what is the towel doing to you? But you are not making the kind of psychological connection, that an emotional connection that person is making to a particular object or a particular thing. All right. And let me show you how the mind works. Have you ever noticed, right, that if you have a friend who has just purchased, for example, a white BMW, all of a sudden you're just seeing a lot of white BMWs. It could have been a rare teal color car, and you thought that, wow, your car is nice. All of a sudden it seems that a lot of those cars are in the market space. And the reason for that is because you have connected with someone who has a color car like that. Then that is not in your mind, because you're always thinking, oh, Mary has a car like that, and so it's in the forefront of your mind. So a lot of childhood experiences can cause anxiety, abuse, the way children are spoken to, fear of certain things can develop at childhood as well. So and even in our adult journey. So we want to make sure that we're trying to understand what is happening when somebody responds to a situation. Now let me just distinguish what is a disorder. A disorder is a type of mental condition. If you have an anxiety disorder, you may respond to certain things and situations with fear and dread, even in a more catastrophic way than just a mild disorder. You may also experience physical signs of anxiety, such as a pounding heart. So you're going to still have your anxiety symptoms, but they're going to seem very extreme. It is normal to have some anxiety, as I said before, but when it seems to go beyond, if you have feelings nervous or anxious to tackle a problem or certain little things, then you know that you are probably gone to another extreme, and you need to get help. Why? Because anxiety interferes with your ability to function. Right? You often overreact when something triggers your emotion. Some persons, once they're in a room, it has to be well lit. It has to be well lit. The room cannot be dark, because the darkness triggers things for them. Right? You cannot control your response to situation. As soon as you see something, you have to turn away. You can't deal with it because of the anxiety. Right? And this happens, for example, the way an accident occurred can also cause it to become anxious. So whenever you pass a particular location, it triggers your anger, your anxiety as well. Now, who are at risk of disorders? A mix of, so anxiety can just occur as a result of just your own life experiences. However, there are some biological factors that can also predispose you to becoming, to having a disorder. So remember, I don't want to say general anxiety, because there is something known as GAD, but just anxiety in itself is something that we all face. It's how long we stay in that space and how debilitating is our response when we are exposed to a situation that we see developing into a disorder. Anxiety, a mix of genetics and environmental factors can raise a person's risk for developing anxiety condition, right? You may have to be at risk if you have had certain personal traits, right? Such as shyness, behavioral inhibitions, feeling uncomfortable with and avoiding unfamiliar people, right? Situations or environment. Stress itself as well, or traumatic events, which we spoke about earlier on, an accident. Some persons will only have one child because they remember the trauma of the first child. So just one is enough for them. Or family history of anxiety or mental health conditions, and certain physical conditions, including thyroid problems and even arrhythmia, unusual heart rhythms. All right, so those are different things that can trigger the anxiety. All right, so it is more often common in women, right? Researchers are still studying why this happens, but it may come from the whole issue of the hormones, especially those that have fluctuated throughout the month. So at certain times, for certain people, they become more anxious than at other times of the month because of the hormone conditions. The hormone testosterone, which is mostly plays a role too. Men have more testosterone, so which is why we probably as females are more vulnerable to the whole issue of anxiety, and it may ease anxiety. It also possible that women are less likely to seek treatment, so the anxiety worsens. Well, kind of disagree with the author here because we usually feel that men are less likely, right, to get treatment whenever for every situation. All right. So what I want to do now, I just want to generally talk about. So maybe you're out there this Sunday afternoon and you are experiencing some unusual unease or sweatiness to certain conditions or features. Remember, you know what has happened to you. You know what you have been exposed to. We have situational disorders where because of where the situation happens, every time you get to that place or you see that person, you become anxious. But unless you disclose what is happening to you, you'll not be able to get the appropriate health care, right, that you really, really need. So let us look at some other conditions that are associated with anxiety. We have what we call, first of all, the GAD, right, which is the general anxiety disorder, which is unrealistic worry or tension. Even if there's nothing to trigger these feelings, somebody just become very anxious and become very uncomfortable. You want to know about this. Most days you may worry a lot about various issues, your health, your work, and so on. But remember, when we talk about disorders, we're talking about extremes of situation. There are some persons who just become anxious and don't even know. They just trigger. They become anxious so easily to the extreme. They have palpitations. They start sweating, and you have to tell them to relax. No, the other one is what we call SAD, which is social anxiety disorder. Healthcare professionals use this to call a condition as a social phobia. And usually, especially sometimes in certain countries, they find that SAD is more prevalent than others. You may have overwhelming worries, self-consciousness with daily social situations, and you may worry about others judging you. Some people will never want to find themselves in a certain space because they say, boy, I'm not beautiful enough. I don't think I can speak like those people. So they become very anxious and really, really terribly anxious, as we said before. And they'll have to leave the room. They start sweating. They start, bodily functions make it out of alignment. That's because of the social environment that they are in. Now, the other one that you usually talk about is agoraphobia, right? And this is an intense fear of being overwhelmed or unable to get help. Usually you have a fear of two or more of these environments, right? So spaces, lines of crowd, open spaces, places outside your home, or public transportation. So that's agoraphobia. So the agoraphobia is you have an intense fear of being overwhelmed or unable to help yourself. Some persons, they definitely can't manage to be in a crowd. Once there is a crowd, they have to get out of the crowd. They just feel clustered. We talk about we feel claustrophobic, right? Because some persons can't manage it. And another set of persons, they can't deal with being alone or being inside a space by themselves, all right? So they can't be locked in an elevator. They have to go into an elevator with somebody. Ladies and gentlemen, we are all made different. We have different features. We are unique in our own way. But always remember this, that we are all fearfully and wonderfully made in the image and likeness of God. Regardless of what we consider to be our gaps, we're still fearfully and wonderfully made. And we should also be appreciative of that. Then there's what we refer to as separation anxiety disorder. The condition most occurs in children and teens when they're separated, for example, from a major caregiver. You will hear somebody say, once my sibling went, once our sibling went, she was never the same. You know, she becomes very anxious easily and so on. So we have separation anxiety disorder. And so even sometimes when we know that a lot of Jamaican parents, they make the decision that for economic reasons, they might have to migrate, whether they have to migrate in terms of local migration or external migration, but they have to make a move to somewhere because of probably financial conditions or so on. Those things can also see a disruption in the emotional well-being of our children. All right, so we want to look out for that. Children with separation anxiety may fear that their parents will be hurt in some way or not, or they may never come back. So, for example, if one parent went away and didn't come back, and say, let us say the father went away, you know, and didn't come back, and then the mom, no matter how she tries to explain to the child, listen, I'm going away, but I'm coming back. That child is not going to take that lightly. She probably can suffer from separation anxiety because daddy didn't come back based on the same promise he made, and now you are telling me the same thing, but you are also leaving. So that's what we call separation anxiety. It happens a lot in preschoolers. Both older children and adults who experience a stressful situation as well may have separation anxiety as well. And let me tell you, I've known of situations where, for example, a person had a cataract and they went to a hospital, right? And it was an elderly person to remove the cataract. Well, after the procedure, I think they stayed a little while in town and then eventually they died. Maybe there were other mitigating underlying situations that caused them to die, right? But then somebody else in their family, because it seemed that they were predisposed to this thing, also had a similar condition. And every time it was mentioned that they were going to Kingston or to the doctor, they immediately had a panic attack because they recalled, that's the mind at work here. The mind is a place, man. They recalled, oh, their aunt went to the doctor for the same situation and she never made it back. So they were like, listen, if I'm going to die, let me die here, but I'm not going to town. And they would have they would exhibit serious conditions of anxiety because of what they know or it happened. So just a little bit about children. It is normal for children to feel some amount of anxiety, worry, or fear. But for example, a child may feel scared of a thunderstorm or a barking dog. A teenager might get anxious about an upcoming test like we spoke about earlier on. But sometimes these situations can really, really cause to see the children often get stuck on their worries. That's when we have the situation. It's going to happen. It's going to kill me. Who is going to kill me? That car or that dog, right? So we have to look at when the situation becomes extreme. And in our culture, in many culture, we oftentimes I can't get away from this, to diagnose things in all different ways except what is the correct thing that's facing the person. But I really want to emphasize today that we need to understand that there are mental health disorder, there are mental health situations, and there are persons who are trained in a particular field so that persons can actually get help. Now, I want to look at one of the common ones as well, which is panic disorder. If you have a panic disorder, you get intense, right? Sudden panic attacks. They just come upon you. You just have these sweaty palms, shivers. I said bodily functions can occur. And these often features become stronger and more intense feelings than other types of anxiety disorder. I mean, it actually feels as if you're choking, like you're being strangled. All of a sudden your tie or your buttons just feel really, really close, as if your air passage is about to cut off. The feeling of terror may start suddenly or unexpectedly, or they come from a trigger. And that is why I think this program is so important, because a lot of times the person who is trying to help you is not aware of what is the trigger. But you might be aware of the trigger, and it's only over time through professional care or you speaking out that we are able to find out what is the trigger. Now, like facing a situation you dread, panic attacks can resemble heart attacks as well. All right. If there's any chance you're experiencing a heart attack, we know that we must go straight to the doctor, right? It's better always, whether it's a panic attack or heart attack, if you're not able to distinguish, it's always best to get professional care. However, during the panic attack, as I said, you're going to have sweatiness, heart palpitation, feeling like your heart is pumping, and also chest pain, which is why it mirrors the heart attack. feelings of choking, which may think you're having, really going crazy now because this is really, really serious. So panic attack is a type of anxiety disorder that mimics a heart attack. But at the time of a situation, you are not the professional, so you can't diagnose. So we always say that you try and get help, right? Now, the last one for this series that we want to look at as we're in the season of looking at emotions and how we respond to situations is the one known as phobia, right? A lot of people have all kinds of phobia. So, like for example, we talked about the space, right? And we talk about claustrophobia, arachnophobia, the fear of anansi. People are fear of height, hydrophobia, fear of water. A lot of people have all kinds of phobias that they have. Phobias are an intense fear of certain specific situations or objects. Of these fears, they sometimes to somebody it don't make any sense. Like an anansi, like why would you be afraid of an anansi, right? Why would you be afraid of rats or something like that? I mean, I'm afraid of rats anyway, but the intense fear that causes you to panic is what is the issue for you to have that panic attack. All right, some people are afraid of snake, but often the level of fear doesn't match the situation, right? So that's what makes it so unusual. So next week, what we're going to do is that we're going to be having our one of our psychologists on, and we're going to go through the different types of phobias and how you can mitigate against your own emotional response. Because, ladies and gentlemen, these can cause problems in relationships. And when I say relationships, I'm not just talking mother-child, but it affects you at work. It can affect you when you become an adult. So you want to be more in touch with what is it that triggers you to respond in such an unusual way whenever these situations occur. As long as you're breathing, there is more right with you than wrong with you, no matter what is wrong. And that's John Kabat-Zinn. So as we wrap up today, I will talk about this issue of anxiety. Remember, if you need counseling assistance, right, our producer is running the number across the screen. We have professional care that we will afford you. So you just need to call us and we will schedule the necessary appointment. But I want you to understand that we have to make sure that we constantly renew our mind and that our mind is in order. Your calm mind is the ultimate weapon against your challenges. So relax. Brian McGill. Can I say that one as a wrap up for you? Your calm mind is the ultimate weapon against your challenges. So relax. Of course, you know that there are many things happening out there. We hear sounds of different things. We see people doing things. We recall different situations. But in our moments of distress, remember, sometimes the situation doesn't warrant the kind of emotional response that can even cause you to have a very debilitating circumstance or outcome. So until next time, let us relax and continue to sip and chat.